So Patty, thanks for your comment. It's a bit of a complicated situation because your husband has already had surgery on his shoulder. And I think that the most important message is to try and understand, why did he get the tear in his tendon in the first place? He needs to change how he's moving and how he's stressing that part of his body so that it doesn't re-tear or become painful and stiff. And from my experience in dealing with lots of patients in his situation, I would guess that he needs to make sure that he's following the 3 R's. He's got to relax the tissue around his shoulder. The capsule that holds the ball and the saucer of the shoulder together is much like a shirt sleeve. It's loose and baggy when your arm's down at your side. It gets tight when your arm goes over your head. If you've had injury or surgery or you have pain and you don't move the arm much, then this capsule can actually close down so that you don't have as much flexibility and you can't actually put the arm overhead. So what you need to do is to gently, and he needs to actively stretch his arm so that it sends a signal to the tissue in his capsule that it needs to lengthen. And what will happen slowly over time is that the body will remodel the capsule so that he'll gain the length and then he'll be able to put his arm over his head. I would also guess that he has tightness at the back of the capsule, and so I would recommend the sleeper stretch. So I'll refer you to one of our previous posts on the sleeper stretch. And finally, he needs to make sure that he's got the proper connection between his stomach and his shoulder blade and the shoulder muscles, so that they're coordinated and working in harmony. And in the future, we'll send some posts which teach you some exercises to do that. But in the meantime, I want him to do the sleeper stretch, to activate the rotator cuff muscle, which we showed on another post, and stay tuned for balancing and coordinating the muscles between your core and your shoulder blade.